Hi everyone, I'm Stephanie, and no, this is not a makeup tutorial video. This is me being sick, having a bit of a chest cold, and I thought what better time than to give you a video, raid my medicine cabinet, and tell you what to look for in your own cough and cold medicines. So what I thought we'd do is go through some of the 4 major symptoms of any cough and cold, whether it's sinus-based or whether it's chest-based, and just tell you what to look for on the labels so that you can read the labels with more confidence and know what it is that you're looking for. I'll also show you some examples that I have here and that I am currently taking because yes, pharmacists get sick too. So I thought the easiest thing would just be to show you the 4 major symptoms and what we use for them. Don't have my regular clipboard, so I thought I'd improvise. So cough is always an annoyance. It keeps you up at night. So there are 2 major drugs that you can use for cough. Dextromethorphan, or also called DM on the label. This will stop a cough. So this is a cough medicine. You'll also see guaifenesin. This product will be listed in medicines that say mucus or chest mucus on the label. So guaifenesin helps to break up the mucus on the chest. So if you have what some people refer to as a chesty cough, or you feel that it's breaking up, you need to get it off your chest, guaifenesin would be good for that. So I do have a note here. Don't take dextromethorphan, or certainly ask the pharmacist if you take antidepressants, because there is a drug interaction between antidepressants that you may take. Common ones include venlafaxine, sertraline, citalopram, paroxetine. If you take those types of medications, then speak to the pharmacist because there is an interaction with DM. I have a sample, I have a bottle of expectorant here. So this doesn't have any DM in it, it's just guaifenesin. So this would be used to loosen up mucus on the chest so that you can cough it up better. Then we have stuffy nose. So if you can't breathe very well at night, or if you're just completely blocked, there are 2 types of stuffy nose medicine that you'll see. So pseudoephedrine or phenylephrine. They're basically interchangeable. They do the same thing. They'll help break up a stuffy nose, but I also have a note here about blood pressure. So people that take high blood pressure medications, or even if you don't take medication, but you know you have high blood pressure, anything that treats a stuffy nose will drive up your blood pressure. So this would again be a question to ask the pharmacist. We actually do have products available that don't have a stuffy nose medicine in it, so it won't help your stuffy nose, but it also won't affect your heart or your blood pressure. So this would be a good question to ask. Runny nose, oh my gosh, runny nose. So if you're up all night with tissues or you're going around sneezing, then you need runny nose medicine. So these medicines are antihistamines, so they'll dry up a runny nose. Oftentimes you'll see them in a nighttime formulation, but it doesn't always mean that it's going to make you really sleepy. And if you've been in to ask my advice, sometimes depending on the patient, depending on what they have coming up, if they're working or if they're off for the weekend, sometimes I will give nighttime medication, but to take during the daytime. So all runny nose medicines are chlorpheniramine, doxylamine, and then you will see some also have diphenhydramine, which is actually Benadryl. So these are some common words that you'll see listed on the label for runny nose. I actually like to pick chlorpheniramine where I can for patients. I find this one just makes people less sleepy overall. It doesn't knock you out as much, I will say. These things are going to dry up a runny nose, dry up a sneezing, but then also you'll hear people refer to a postnasal drip, which means when they lie down, it's actually running down the back of their throat and then creating this tickle and they're coughing. So it will dry up a postnasal drip as well. Last major symptom is a sore throat. And people are always looking for lozenges for sore throat, but oftentimes pain medication will actually work the best. Ibuprofen is probably the best of everything. Advil is the brand name if you watch my generic brand name video. So ibuprofen is a pain reliever, but it's also an anti-inflammatory, so it will bring down any swelling that's in the throat. However, you want to stay away from this drug if you take any blood thinners or if you have high blood pressure. Definitely ask your pharmacist. Another option you'll see in a lot of drugs or a lot of combination pills is acetaminophen, which is a brand name Tylenol. So that can help with the pain of a sore throat as well. Those are your major symptoms, and I just wanted to give you an example of what I have here. So this is extra strength cold medication nighttime. So what does this drug actually have? So you can read on the side of the label. I don't know if you, yeah. So this drug has acetaminophen. So this would be for your pain and your sore throat. It has chlorpheniramine. So this is your runny nose medicine for sneezing, a postnasal drip, and runny nose. It has dextromethorphan. So this is for your cough. And it has pseudoephedrine. So this is for your stuffy nose. And remember I said that I sometimes give people nighttime medicine to take in the daytime. So this would be an example. It's a nighttime medicine, but the drug that's making you sleepy is chlorpheniramine, which is for a runny nose, and it's not an overly sedating drug. So it's not something that is going to knock you out. So in this case, I have taken this today, and it doesn't make me too sleepy, but that's certainly something that you need to be careful of if you're driving or working. I'm off, it's Saturday. Other thing is make sure you keep your fluids up. I posted a video on that as well. So drink lots of fluids. And then if your lips get dry, just keeping some lip chap around. I use just plain old Vaseline. So there's lots of things you just have to give yourself time. Get some rest, drink lots of fluids. And if you're not sure what you should take, if you're taking other drugs or you have allergies, or you have medical conditions, go in and see your pharmacist, and I'm sure they'll help you pick something out. I'll be feeling better by Monday. I'll see you back then.